very heavy, lightly close into that and open just a little. Lightly close in and then open, lightly close and then open again. Excellent. We'll trim away a little bit of excess wax. Basically, we don't want the wax to extend too far where it's going to cause any displacement of muscles. We want just to be able to capture just the free closure point of your jaw, just a normal anatomical closing of your jaw. Let's just gently close into that. Excellent. Open just a little, close. Now just hold that right there, don't squeeze anymore. Just as we did before, I'm going to mold this wax so it goes in all the indentations, so it gives me a very definitive orientation of just how this relates to both the upper and the lower teeth. So I'm getting it, turn this way just a little bit, I'm getting into all the indentations of the upper and lower teeth. And then open. We're going to pull that. We have this back in place. And then just gently close in here. Now, one of our double checks is the jaw joint is our wonderfully resilient joints. They're beautifully designed, and if the joint is in a bone braced position, I should be able to almost lift the patient out of the chair by putting pressure, a loading pressure on the jaw joint. And this is a very standard type of test. If an orthopedic surgeon wanted to test if your knee was able to hold up the weight of your body as you walked, if you were able to walk with your knee, they basically press on the sole of your foot and press up towards your leg to see if the knee could absorb that amount of force. That's what we call a loading force. So a loading force for a jaw joint is where we're basically seating the joint in its socket and seeing how the muscles react to that. And if the joints are in a bone braced position, then I should be able to put a great deal of pressure here and have the patient feel absolutely no pressure or tension at all in this area. That's because it's a bone braced position. If either joint were a little bit out of its socket to where it was a muscle braced position on that side, then we would find some pressure or tenderness there, and we would need to retake the bite registration to make sure we're getting a bone braced position. But another test of a joint is just a load test, and to see if there is any pressure or tension or pain that is associated with just loading that joint. If the joint has good integrity, then and there's still pain, then you've almost ruled out anything but muscle. And muscle is one of the most predictable things to reverse, and that's just by helping to get the joint functioning in its bone braced position. And we can do that with either appliance or adjusting the bite in order to basically make the teeth in harmony make the way the teeth come together in harmony with the jaw joint, and that's adjusting the bite, and that's something I'll go into later for you. Go ahead and open. But most of the work that we do in analyzing the bite, we do when the patient is not here, and that's with the models of the teeth on the jaw simulators. We'd end up with two different jaw simulators, one a before of just how the patient is now, and then an after on what changes we can make in order to have things healthier and more predictably comfortable for the patient. Thank you very much.